Hi, my name is Janine Polito, and a big part of what I do here at CAFL is to help agents that want to be able to add Medicare to the lines of business that they offer, help them get where they want to be in that part of the business. So reach whatever goals they have. And part of that is this training. So what I have is 5 modules, and it's basically, if you are familiar with the AHIP, which is a class that you take online, and then there's a time test at the end. So I've based this PowerPoint that we're going to be looking at the AHIP training. Not all companies require that you take the AHIP, but I think it's a good idea for any new agent or anyone that really just wants to maybe wants an annual refresh, because things do change. So what we're going to talk about today, it's a basic overview. This first module moves pretty fast, so don't get overwhelmed by that. In further modules, we're going to go into more in depth. So, the first module, like I said, moves pretty quickly, and we're going through this, just kind of jot down any questions that you might have, and give me a call. I'm going to have my contact information at the end, my email address and my phone number, so you can give me a call with any questions. So let's get started. So what we're going to be talking about today, Medicare program basics, how people can get Medicare, who's eligible, how much is it going to cost, people that have limited income, what we can do for them. Original Medicare, what exactly that means. Part D, the drug plan, beneficiary protections, and you'll hear that word a lot, beneficiary. And if you're involved in other lines of insurance, just know that that word means something different in the Medicare world. It's the person that's covered under Medicare. So that's a little bit different. Medigap, we're going to touch on Medicare supplement plans. So that's the same thing, Medigap, MedSups. And then what happens if someone's turning 65 but decides to keep working? Okay, so we're going to talk about all of that today. So Medicare basics. Who qualifies? It's for people that are 65 and over, and also people that are younger than 65. If someone has been on Social Security disability for at least 24 months, they're going to qualify for Medicare. And also people that have certain diseases, and we'll talk about that. Income doesn't come into play for Medicare eligibility, but what you do need to know is that if somebody is at a higher income, then they may end up having to pay more for Medicare. And if they're at a lower income, there is a lot of help out there. So, just kind of keep that in mind. Again, we're going to talk about that in greater detail. So if somebody is on Medicare, they can stick with what they call original Medicare, which is Part A and Part B. A drug plan, you have to have drug coverage, so they hopefully would have a drug plan in addition to that, or a Medicare Advantage plan, or a Medicare supplement in addition to A and B. So there are different ways that someone can have Medicare. So parts A, B, C, and D. Parts A and B are what are considered original Medicare. Part A is inpatient coverage. So Part A is inpatient coverage. In the hospital, it's going to be skilled nursing facilities, rehab facilities, and hospice. Part B is referred to as medical coverage. So outpatient, doctor visits, that type of thing. Okay. Part C is Medicare Advantage plans. And then Part D are drug plans. Well, this mentions Part E. The only way I would think that you would need to even know that there's a Part E is if you are going to take the AHIP. It's never come up. People talk about Parts A and B. They talk about C, the Medicare Advantage, talk about D, but Part E, it really doesn't come out at all. But what Part E covers are Medicare cost plans, which we're going to review briefly in this training. Not going to go in depth. The reason for that is that I'm not aware of any cost plans locally. So it's something that it's good to know about, but I really don't know of any cost plans locally. And then Medicare supplement plans or Medigap. So that's the same thing. Medicare supplement plan, Medigap, same exact plan. So they're talking about both of those as being part of a Part E. So again, there's different ways that someone can get Medicare. They can have just original Medicare, Parts A and B only. They can have a Medicare supplement, a drug plan. They can have a Medicare Advantage plan, and then the cost plans that we mentioned. Now, this is a visual that is included in the AHIP training, and it's kind of goes through what's involved with each type of Medicare coverage. So, if someone is going to have Parts A and B, what that includes, Part D, if they're going to have a Medicare Advantage plan. I'm not a huge fan of this visual, so what I did was I inserted this. Now, this is from a United Healthcare publication, and it's not company specific. United Healthcare just happens to have really good resources out there on their website. So I personally like this. I think it's a great visual if you're meeting with your clients. I know that this doesn't show up great on this PowerPoint. If you want a better copy for your clients, let me know. Like I said, that it is on there on the toolkit on Jarvis, United Healthcare. So basically what this is, the top is showing the first step, which is when someone is enrolling in Medicare. That's step one. We really can't go ahead with anything else unless the person is enrolled in Parts A and Part B. Okay, so that's the first step, is that the person enrolls in Medicare. And then, once they have that, once they hopefully have their card with their number on it, because you need that for them to be able to apply for anything else, then it's a conversation. What are their needs? Are they someone that, they really need dental, vision, and hearing? In addition to Medicare A and B, and there's no dental, vision, and hearing in those two plans, A and B. But if that's something that's important to them, probably looking at a Medicare Advantage plan. If they don't care so much about that, but their concern is, how am I going to pay for the cost of Medicare? I have a lot of health issues. How am I going to pay for this? Then that would be a Medicare supplement. Again, a Medicare Advantage plan is going to have drug coverage. There are some without, but most have drug coverage included. But if they go with a Medicare supplement, there's no drug coverage, so they would need that separate drug plan. Again, this is a quick overview. We're going to go through all of this in greater detail. But like I said, I really like this visual versus what they had in the previous screen. And I do think that it's a great way to hopefully help your clients understand what their options are. So original Medicare, again, it's Part A, Part B. Part A is inpatient coverage. It's skilled nursing, hospice, home health. Part B is medical, so outpatient, doctor visits, that type of thing. Okay, so that's Part A and Part B. So who is eligible? You have to be either age 65 or older, Or you can be under 65 with certain disabilities, and it can be someone that's been on Social Security disability for 24 months. They'll automatically get a Medicare card in the mail. Okay, don't have to do anything. Social Security keeps track, and once that 24 months has come in, they'll send a Medicare card. And individuals that have ALS, which is Lou Gehrig's disease, or end-stage renal disease. Now, one of the things that when I first started learning about Medicare, this crossed my mind, so maybe it'll cross your mind too, is why ALS and end-stage renal disease? Why those two diseases specifically? So I looked into that, and back in 1965, when Medicare was first being developed, there was a team of people that were doing the developing. And on this team, there was someone that had a family member with Lou Gehrig's disease, and there was someone that had a family member with end-stage renal disease, and they wanted to make sure that their family members would be covered under Medicare. So that's why it's those two specific diseases. I thought that was interesting. Have to be a U.S. resident, either a U.S. citizen or lawfully in the U.S. and been here for 5 continuous years before filing an application for Medicare. Okay. So, we talked about this. If someone has been on Social Security disability for 24 months, they're going to automatically get that card in the mail. They could potentially refuse Part B if they want, and we'll talk about why they might want to do that, but they do have the option of being on Medicare A and B. And again, people that are, have ALS or end-stage renal disease. So what I'm finding is that there is a common belief, and that is that people are automatically signed up for Medicare. Now, like we've talked about, if someone has been on Social Security disability for 2 years, they're automatically signed up for Medicare. Other than that, you do have to sign up. So if someone, you just have to go to ssa.gov. You can go into the Social Security office and sign up for A and B. Let's say someone's 65th birthday is mid-June, for example. Medicare will be effective as of June 1st. If their birthday is June 1st, then it'll be effective May 1st, so the month prior. Okay. So let's say someone doesn't enroll in Part B initially, or Part A if they have to buy it, and we'll talk about that. Every year there's a general enrollment period that goes from January 1st through March 31st. Somebody can sign up for Part B if they didn't previously. Coverage will begin on July 1st. So what you want to keep in mind, and we're going to talk about the Part B penalty if somebody has gone a year without having Part B and they didn't have other coverage that qualified them for being able to put it off. There's a penalty if they go a whole year without that coverage. Since there's a delay, they apply, say in January, coverage doesn't begin until July 1st. That could put them into the time frame of where they have a penalty. But there is that period at the beginning of every year that they can sign up for Part B. And then again, we're going to talk about if somebody has group health insurance, say they're continuing to work past age 65, or their spouse is continuing to work past 65, they have what's called creditable coverage. We'll talk about that. There is a possibility that they can put off getting Part B. Most people take A because they've already paid for it, but it's conceivable that they can put off B. So, Part A, if somebody has worked at least 10 years in their life or their spouse has, um, they don't have to pay anymore for Part A. So sometimes people say Part A is free. It's not free. You've just already paid for it through 10 years at least of payroll deduction. So most people don't have to pay anymore for Part A. There is a cost involved in B that we'll talk about in a bit. So again, someone can have either original Medicare A and B, they can have Part C, which is going to give them all the benefits of A and B, in addition to those additional benefits, dental, vision, and hearing, but they have to reside in the planned service area. So, part of the process of determining what someone's options are is asking for their zip code and the county that they live in, because it's going to tell us what plans are available in their area. So Part C, Part D, and for Part C, you have to have A and B. It's a little misleading how that's worded there. It says be entitled to Part A and enrolled in B. You have to have A and B to have a Medicare Advantage plan. Part D, drug coverage. You have to be entitled to A and or enrolled in B, and also reside in the planned service area, and then cost plans. Again, there aren't any cost plans that I'm aware of anyway, locally. So Part A, most people, like I said, are entitled to A without paying a premium because they've worked at least 10 years in their life or their spouse has. And then, people that have end-stage renal disease, ALS, are eligible for premium-free Part A, or if they're eligible for Medicare due to a disability. So if someone does not automatically qualify for premium-free Part A, it's kind of rare, but if you come across somebody that hasn't worked that long in their life, or their spouse has not, in 2021, the monthly Part A premium, if someone had worked less than 30 quarters, that's what they're going to pay. Now, that figure is in what it was in 2021. So what I have here, if you see me looking down, it's I have the 2022 figures. It'll kind of give you an idea of how much it's increased over the past few years. So in 2021, if somebody worked less than 30 quarters, then that's what they were going to pay, was $471. In 2022, that's gone up to $499. Like I said, it's super rare. I don't know if I've ever met anybody or talked to anybody that had to pay for A, but I'm sure people are out there. And then if they've worked or paid Medicare taxes for 30 to 39 quarters, in 2021, they would have paid $259 for Part A. In 2022, it's $274. So it has gone up a bit. So let's say that someone has to pay for Part A. It's not something that they're not, is going to be, they've already paid for. If somebody does have to pay for it and doesn't take it when they're first eligible, there is a late penalty. It can be up to an additional 10%. Okay, super rare. Like I said, I don't know if I've ever even come across that. So Medicare premiums for Part B. In 2021, most people paid $148.50 for Part B. Now, in 2022, there was a big jump in Part B. It went from $148.50 up to $170.10 is what the current cost that most people are going to pay for Part B. So why the big jump? It's been for a few reasons. With COVID the past few years, the healthcare costs have risen astronomically. There's also a Alzheimer's drug that is super expensive, and because of that drug, they raised the cost of Part B in 2022. So it's a combination of the two things. It's the cost of that drug and COVID, basically, and the huge rise in healthcare costs that really affect who we're talking about, seniors, more than anyone else. So I said most people pay 170/10. Now, some people, if their income is higher, I mentioned this at the beginning of this training, they may have to pay more for Part B. And it's something called IRMA, which is the income related monthly adjustment amount. So again, these are the 2021 figures, started at 148.50, and it went up to the most that somebody could pay is 504.90. All right. And they look at how income tax returns are filed, if it's an individual tax return or a joint tax return. And these figures have changed a bit. In 2022, most people, like I said, pay 170/10. The most that someone would pay is 578.30 for Part B. One thing to keep in mind with this, let's say someone just retired and they look at income tax returns from 2 years ago. Maybe they had a high income, they're retiring. Usually income goes down when somebody retires. So what they pay initially isn't necessarily what they're going to pay forever. They can apply for a reduction in what they have to pay for Part B. But just be aware, most people this year are paying 170/10. Some people, at least initially, have to pay more. Okay, so how does this get paid? Most people have it taken out of their Social Security checks, Part B premium. That's a possibility. There are people that want to get a bill, in which case they'll get a bill and they'll have to pay 3 months at a time. It's possible that an employer, if someone retires and the employer agrees to pay their Part B premium, that's a possibility. And then there is a penalty. Okay, if somebody doesn't apply for B initially, they don't have other coverage that's as good as what original Medicare A and B will cover, then there could be a penalty. And the penalty is for the rest of their lives for Part B. It's tacked on to what they owe monthly, and it's for the rest of their lives. Now, this talks about the exception. Again, if somebody is going to still work and they have coverage through their employer, and the coverage is at least as good as what they would have through Medicare, they are able to put off B and not worry about a penalty. Okay, so chances are you work with people that are higher income and might think that you won't come across people that are lower income. Happens all the time. I have agents that say that to me. I'm probably not going to come across anybody with limited income, and then they'll call me and want to talk about dual plans because they did have someone contact them. So if we come across someone that is of limited income or resources, there is a lot out there to help. There's something called a Medicare Savings Program that will help potentially pay for premiums, deductibles, cost sharing. There's something called Extra Help, LIS, Low Income Subsidy, that will help pay for drug costs. There's Medicaid that is help with healthcare costs. I mean, there's a lot of help out there for people. So basically, what we are asked to do, if you come across somebody that is of limited income or resources, have them contact, have them give 1-800-Medicare a call, and they'll be able to start the process. It's worth checking into. So just wanted to mention that. We're not supposed to get really into the nitty gritty of what they might qualify for. We're supposed to refer them to Social Security office or 1-800-Medicare, and they'll be able to help them through that process. So Part A, what is included in Part A? Again, it's inpatient coverage, skilled nursing, hospice, up to 100 days of home health care. There's no long-term care in Medicare. Okay, so that's important to know. Now, in 2021, again, and these are the inpatient hospital costs. So we're going to compare 2021 to 2022. So each benefit period, there's a deductible. And again, this is through Original Medicare. This is through Part A. It can be different if they're on a Medicare Advantage plan. The deductible in 2021 was $1,484. That went up to $1,556. A benefit period is the day someone is admitted, and ends when they've gone 60 days in a row without hospital or skilled nursing facility care. Okay, so the first 60 days after they've paid their deductible, there's $0 co-insurance, and that doesn't change in 2022. Days 61 to 90, the co-insurance had been $371, went up to $389. Days 91 and beyond, it was $742, and it went up to $778, and that's each lifetime reserve day after 90-day benefit period. There's up to 60 days. And then beyond the lifetime reserve days, all costs are covered. So, you know, depending on what someone's situation is, this could really add up. And like I said, maybe a Medicare Advantage plan, you know, at least it'll have an out-of-pocket maximum. They'll be able to hopefully cover their costs a little bit better. So this is skilled nursing. So let's do the comparison for skilled nursing. 2021, again, the first 20 days, there was no cost. That hasn't changed. Days 21 through 100, it went from $185.50 per day to $194.50. And then days 101 and beyond, it covers all costs. Okay, so that's the benefit guideline in Original Medicare. Medicare Advantage plans can have better than this, can't have worse. Okay. So Part B, what's covered in Part B? Again, Part B is going to be medical coverage, doctor visits. So there's a benefit for, besides doctor visits, outpatient hospital services, clinical lab diagnostic tests, some durable medical equipment, you know, some home health care, medications. It's really, that's very limited as to medications, drugs that are covered under Part B. There are some. So that's benefits of Part B. Here are some additional benefits. Very limited chiropractic services. There are some diabetic supplies, very limited glasses, but these are some things that are in Part B. Okay, so Part B in 2021, there was a $203 annual deductible, which meant that the person had to pay the first $203 before the benefits kick in. That went up $30. So it's $233 in 2022. After the deductible is satisfied, beneficiaries typically pay 20% of the Medicare approved cost for Part B. So what to keep in mind with this, though, is with original Medicare A and B, there's no out-of-pocket maximum. So you think, okay, 20% of the Medicare approved cost, considering that there's no out-of-pocket maximum with just original Medicare, that can add up really quickly. You're going to see an out-of-pocket maximum with Medicare Advantage plans, and they'll be able to get an idea of what their costs will be with MedSup. So that to me is a huge concern. If somebody just is going to stick with original Medicare A and B and maybe a drug plan, is the fact that there's no out-of-pocket maximum. So additional Medicare Part B benefits. I think that there's a lot that are covered under Part B. There's a welcome to Medicare physical, and then there's an annual wellness visit every 12 months. There's certain immunizations. Now includes the COVID vaccine, bone mass measurement, mammograms. There really are a lot that are included as far as preventative, okay? So what's not covered by Medicare A and B? Again, there's no dental, vision, and hearing, so you're going to see those on this list. Obviously not cosmetic surgery, travel outside the US, that's not going to be covered. Potentially emergencies and urgent, but seeing a doctor, that's a problem if somebody is outside the US. It can be when telehealth comes into play, though. So these are all things that aren't covered by Medicare A and B. So original Medicare and Part D. There are different ways that someone can have drug coverage. Remember, you have to have drug coverage or else there could be potentially a penalty. I've talked to people before that maybe they turned 65, they weren't working, they took A and B, they're paying for B, but they're not on any prescription drugs, so thought, why get a drug plan? I'm not on any kind of prescription drugs. And then in the future, when they do go on a drug plan, they realize that there's a penalty because they've gone, so long without there being any kind of drug plan. So I've definitely seen that. So somebody can have a standalone drug plan, or they can have it as part of a Medicare Advantage plan. Okay. Let's see, it talks about the annual election period, October 15th through December 7th. We're definitely going to go into election periods in a future module. And with Part D plans, I'm not familiar with any $0 Part D plans. I do know of $0 Medicare Advantage plans, but not Part D. So they're going to pay a monthly premium. There's a annual deductible, and then there's a per prescription cost sharing, depending on what prescriptions they're on. And part of the process is looking at that drug list that someone has, dosage and frequency, and then comparing either the different Medicare Advantage plans or the drug plans to see, what their cheapest option is, because that's what everybody wants is, most benefit for the least cost. So beneficiary protections in original Medicare, there are appeals for Part A and Part B coverage. So beneficiaries or people that are on Medicare are going to get a MSN, which is a Medicare summary notice, and it's going to let them know the status of any claims that have been filed on their benefit. So if there's something that the person doesn't agree with, they're able to file an appeal. Okay, there's going to be directions. They can go on either the company website, depending on where they have their coverage through, or Medicare.gov. They have 120 days of the date that they get that Medicare summary notice in the mail to file the appeal. All right. And there are directions, and they should. I mean, I always would encourage appeals because you have nothing to lose. And, you know, I've definitely heard of appeals that have been successful. So there's also guarantee of a fast appeal. So let's say someone is in or in the hospital, their time at the hospital, according to Medicare, is coming to an end, and they believe, and their doctor believes, that they need to stay in the hospital longer. What this fast appeal means is they file the appeal, and then the insurance company has to respond quickly to let them know that either yes, you can stay longer, or no, you can't. But that's what this whole fast appeal is. And then a grievance. A grievance is if somebody doesn't agree or isn't happy, I should say, with the quality of their care. And it can be from a hospital, it can be with a doctor, but the instructions for filing a grievance are on the Medicare.gov website. Additional protections, there are a lot, and this is another thing that we're going to talk about. Marketing is different. Marketing, Medicare is going to be different than probably what you're used to, and that's because of beneficiary protections. People can call 1-800-Medicare. There's a state health insurance assistance program that they can get help through. Find out claim status if they have questions about Medicare or anything like that. Now, a lot of the screen, or not a lot, but some of the screens in this PowerPoint I took out, this is one that I wanted to keep in just so that you're aware of where we can get additional information. Medicare.gov, I reference that a lot. There's a lot of information on Medicare.gov. Be aware that your clients can sign up for Medicare Advantage plans on Medicare.gov without you. So, you know, just be aware of that. There is a Medicare and You handbook. I know it used to be mailed to people annually. I'm not sure if that's still a thing. I think it is. But it's also helpful for us if we are maybe, you know, needing a little bit of a refresher. So the Medicare and You handbook, and that's actually also on CAFO's website. You could access that. So there are a lot of publications out there that can help both us and our clients. So Medigap coverage, Medigap, Medicare supplement, same thing. The word Medigap, where that comes from is it fills in the cost gaps of Medicare. So that's the gap in Medigap, but it's Medicare supplement, same thing. Again, no additional benefits, dental, vision, and hearing. It works with Medicare to help pay for the costs. It's sold by private insurance companies. There's no additional benefits. And we're going to talk about what is included in med subs. You know, there's definitely a place for Medicare supplements. Some people see what their costs could be in Medicare. Maybe they have a lot of health issues and it really concerns them. And they're not so much concerned about dental, vision, and hearing. So there's definitely a place for Medicare supplements. So it's not the same as a Medicare Advantage. Two totally different things. You can't have both. I've had that asked of me. So is the best thing I can do is to sign up for a Medicare supplement and a Medicare Advantage plan. It's not possible. You can't have both, and it's actually illegal to sell a Medicare supplement to somebody that is already in a Medicare Advantage plan. So basically how it works is, let's say somebody has a Medicare Advantage plan. They've decided for whatever reason that they want to move to a Medicare supplement. How we accomplish that is we have their Medicare Advantage plan ends at the end of 1 month, and the Medicare supplement starts the first day of the next month, so that there's no overlap. But yeah, you can't have both. So entitlement, enrollment, and Medicare premiums eligibility. So Medicare supplement plans are standardized. And what that means is that a Plan A with one company is going to have the same benefits as a Plan A with a different company. Okay, so what do people then look for? Some people have company preferences, but most people, if it's going to be the same benefits, okay, where is it cheapest? So that's frequently what we look at, is once it's been narrowed down to a specific Medicare supplement, and they're all letter plans, you know, Plan A, Plan D, Plan G, Plan F. Most people want to look at who has the cheapest coverage. Okay. Another thing that's referenced on here is an open enrollment period. So a benefit of being in New York State, and if you're not in New York State, this is still important to understand. In New York State, there's no underwriting for Medicare supplement plans. So someone signs up, even if it's not in their first, when they're first turning 65, even if it's not in that initial enrollment period, there's no underwriting. There is underwriting in other states, but there isn't underwriting in New York State. So they talk about guaranteed issue, not really a thing in New York. Well, I guess it is a thing, but it's for everybody. The only potential issue is in New York is that if somebody signs up for a Medicare supplement and they had no coverage previously, all right, they're just signing up for Medicare and MedSup, they are coming from no health coverage at all, there can be a 6-month look back for pre-existing conditions. But if somebody is going from one health coverage plan to a Medicare supplement, they're able to do that, and we don't have to worry about underwriting. So there's going to be a chart shortly that you'll see what the different Medicare supplement plans cover. Of course, the monthly premium is going to be higher the more that it covers. That's obvious. So they're going to cover Part A coinsurance. There can be additional hospital days that they'll have in addition to what Medicare will cover. Part B coinsurance or copay. There can be some hospice care add-ons, Part A deductible, skilled nursing. So it really is an add-on to Medicare as far as the costs. All right. So this is going to kind of give you an idea, but like I said, there is a chart that's coming. Prior to January 1st, 2006, people were able to sign up for H, I, or J Medicare supplements. And I kept this slide in case you come across anybody, because they are able to still have these plans. I've never heard of anyone that still has these plans, but I'm sure they're out there. So H, I, and J, they did have drug coverage included. So if you come across, just know that, and they have different options. They can have the drug portion of the coverage removed and enroll in a standalone drug plan, or they can drop it and enroll in a different kind of plan. But so just be aware that these are plans that might be floating out there somewhere. So creditable coverage. This is important to understand because let's say someone is going to continue working, and creditable coverage is based on current employment. So they're going to continue working, or their spouses, they're over 65, they want to put off Part B. What this is we need to make sure that whatever coverage they have has benefits at least as good as Medicare A and B. Okay, if they have creditable coverage, then we don't have to worry about the Part B penalty when the time comes that they stop working and they're going to pick up B. Okay, one thing to keep in mind with creditable coverage is if somebody is continuing to work, but for some reason is on COBRA, or they're not working and they're on COBRA. Again, this is normally based on current employment. COBRA is not considered creditable coverage. I know that there's legislation right now in place to make COVID, to make it creditable coverage, but as of right now, COBRA is not considered creditable. Okay, after December 31st, 2019, people were not able to get two plans that covered the Part B deductible. F, which is including high deductible F, and C. So what this means is if somebody is turning 65 or became eligible for Medicare after December 31st, 2019, they no longer have access to these Medicare supplement plans. Now, if somebody was 65 prior to that date, they still have, this is still available for them. Okay, so it's mainly people that were not 65 prior to that date. If somebody is just turning 65 now, no, they will not have. But if they were 65 prior to that date, yes, they can sign up for one of these plans today. I understand that that's confusing, but just know that, you know, there is a special situation as of those, you know, for those plans, F, high deductible F and C, and that December 31st, 2019, January 1st, 2020 date is important. So talked about Medicare supplement plans. These are, and every enrollment kit is going to have a different chart. I'm not a huge fan of this chart because it covers two screens. There are one-page MedSup comparisons, which I like better. I think it's easier for your clients to take a look and see what their options are if they've decided on a Medicare supplement plan. But, you know, this is what they offer, what they cover. So you'll see Plan F, which is at that last category, the reason why it used to be the most popular plan, and you'll see why, because it really does cover everything. You'll see everything except for foreign travel emergency. There is a benefit for that, 80%. So Plan F covered, I hate to say everything, but it really did. Plan C covers most everything. There's a few things that it didn't cover, but you know, and again, the higher the premium, the more it's going to cover. So let's say you're talking to somebody that is going to continue working. They're turning 65 and they want to know, you know, what do I have to do? Do I have to sign up for Medicare? You know, what are my next steps? And as I think you'll get probably that call frequently. And it really depends. So if somebody asks that question, what you want to know is, you know, where do you work? How many employees are there? If it's less than 20 employees, then Medicare pays first, so they have to sign up for Medicare. If it's more than 20 employees, then they're going to have more options. They're going to be able to stay on the group health plan that they have through their employer. I mean, they don't have to, but they have that option. They can stay on that group health plan. And at that point, it's just a comparison. There's a lot of really good group health plans on there, so it may be worth it for them to stay on that. But at that point, it's really just a comparison. Okay, this is what you have access to in your large group health plan. This is what the difference would be if you went on Medicare and picked up, say, a Medicare Advantage plan. Okay, so just know that 20-person employee question is going to determine what their question or what their next steps are. So large group health plan has 20 or more employees, okay? Like I said, they're going to have more options. A small group health plan is less than 20, okay? Large group health plan, if that's what your employer has, they are not able to encourage you to go off that plan and take Medicare. Again, this is a large group over 20. It's against the law for them to say to an employee, we need you to get off our group health plan and go on Medicare. Can't do that. Okay. So again, these are what they can't do. They can't encourage you to get off of there. They're going to offer you the same as everyone else. They might have a group Medicare Advantage plan. That's possible. Again, at that point, it's just going to be a comparison. You know, how does the group Medicare Advantage plan compare to what you would be able to get as an individual? And then if it's a small group, less than 20 employees, Medicare is gonna pay first. Person has to go on Medicare, A and B, and then at that point, you're gonna look at what, in addition to Medicare A and B, do they want, okay? So this is the end of today's training. Like I said, there is a ton in this training. I talked really fast. I realized that. We're going to go into everything in this first overview in greater detail. So if you have questions, feel free to pick up the phone at this point and call me. Phone number 585-271-6400. My extension's 101. Or shoot me an email. It's Janine@kafl.com. Janine is spelled Jeanine @Kafl, K-A-F like Frank, L like Larry.com. So this was Module 1, and we'll move on to Module 2. Thank you very much, and we'll talk soon.